Dr. Andrew Miller, President of the AMA-WA. Thanks for the opportunity to talk to you again today about the two important things that we're trying to do, which is reduce the number of cases and secondly, avoiding overwhelm and getting prepared. On both of these, we're calling for much smoother management. We realise that this is a difficult time for government, and the government have our full respect and gratitude for all of the things that they're doing. However, we don't think that it stops being a democracy, and we think that other opinions, particularly those who have skin in the game, the frontline doctors, nurses and other workers in the hospitals, the GPs, the aged care providers, we should all be heard by government and by the community at this important time. You need trust to get the population to change its behaviour. There are two groups in our population at the moment. There are those who think this is a problem, who've accepted it, they've grasped it, and they're getting on with changing the way they live. That often includes frontline healthcare workers and their relatives. It includes the disabled and people with chronic illness and those who care for them and anyone who has an intersection with the sector. They're all very convinced that we need to slow this down. There's a big group of the population left, though, who aren't quite convinced, and some of that comes back to some mixed messaging they've received. We now seem to be having conversations about how long is too long to have a haircut. Which jobs are essential? Well, every job's essential. Cruise ships are not allowed to dock, but then they dock. Elective surgeries are off and on, then off again. And government workers are not allowed to work from home, and there's FIFO still going into the regions. So it's not surprising there's a group of the population that are still suspending their judgment about whether or not this is a big problem. And I'm here from the front line to assure you that it is. Look at the international news, see what's happening, not just in China, not just in Europe, but in the US, where they do have very clever people running very clever institutions at many levels. I got abused by a stranger in the street today, which wouldn't come as a surprise to some of those of you who know me, but they were quoting to me that they'd read in the paper on the weekend that it was still fine to go to the pub. However, what's changed about the virus in a few days, that they have to move towards lockdown. We need a much tighter briefing for the public, and if it takes a military-style person to deliver that, then that will, I think, raise the confidence of the public. For the front line, their confidence is being dented about that what is being promised will actually be delivered, particularly in terms of the personal protective equipment that we need to do our job safely, to stay alive, so that we can save other people. The problem of delivering projects by government was described to me well by a regional doctor today who contacted me from a small town, quite distressed about the lack of facilities, the lack of support, and the fact that there will be people coming into their town this weekend, which means there could be virus coming into their town this weekend. He says there seems to be a real dislocation between management and the clinicians, and the decisions at the top are not being implemented. GPs, even in the metro area, are having to fight to get a COVID test still when they're sick. So the minister says they can get it, but when they go to the clinic, they're told, well, we have verbal orders that it's only for employees of the public hospitals. I was contacted by a casual nurse who's sick, who cannot get a test. And she says that she is an agency nurse, so when she's not working, she's not getting paid. And she said something really important. She said, now I have no income, but that is for later, not for now. And as a society, we understand, and our heart goes out to those of you who are suffering because of the things we're asking for, because you have no income, or because you see what's coming for your business. But it's a health problem. If we fix the health problem, then later we can fix the economy. So yesterday we had another directive which has expanded the testing so that we can find out where this virus is, but in a complex, another complex iteration, so that everyone has to now absorb what the new rules are. We would like the government to expand to private pathology who are ready to do the testing, so that doctors can order it in the metro area and they don't have to go to a COVID clinic because patients are reluctant to go there. In terms of reducing the flood of cases, of course, we now have to talk about the cruise ships. We've always known the cruise ships were out there. They always had to come back to somewhere. They've been on the schedule. I realise this is a complex problem to sort out, but it shouldn't be a political problem. There shouldn't be an argument going on between the state and the feds, particularly when we have this national cabinet which is coordinating everything. The public and the profession are confused as to why there's any issue about it. I would say that we must help these people. If there's sick people, it doesn't matter where they're from or how they got here, we need to help them, and we need help from the federal government to do that, and we support the Premier in his attempts to get that fixed up quickly. In terms of social controls, we're calling on public servants to be allowed to work from home. A lot of them are set up to do so. Their kids are now home from school, which is a great initiative that we would have liked to see earlier. But for many people, that presents a childcare dilemma. So please, for them and for the others, particularly the vulnerable in their own health, let them work from home. There are many examples through the health system, such as breast screening is still continuing. Breast screening is an incredibly important and valuable thing in our community, but this is not for women who have a known problem. This is just to see if they have a problem, and we know that it can wait for a little while. And in the meantime, we have a lot of people coming to health facilities who don't need to be there. The lockdown's inevitable. The sooner we do it, the more effective it is, and hopefully the shorter it will be. We know that there are different opinions about when we should go to this. The Chief Health Officer in Victoria seems to want it sooner, and we think that we should be more conservative in a situation where we don't know how many cases there are and we're not fully prepared on the front line. The economy will recover better if we don't get fully overwhelmed, and we need to test now to understand our enemy. The preparations in the private hospital system have started, but they've only just begun. They are the biggest part of our system in Western Australia. They have more beds than anyone else. When you buy a ventilator, there's been a lot of talk about ventilators. That's what I do in my job each day. I ventilate people. But buying a ventilator is a bit like buying a racing car. After you buy the ventilator, you have to go find a driver and a team, and you all have to train to be able to actually do anything with it, let alone start winning any races. We need more time to put all of that in place. There's been a lot of talk about masks, about gowns, about gloves, about the headwear that we need to have in the situation when we have a lot of these patients. We need to have a very simple business case put on the table from the government to tell us the numbers they have and the rate at which they get used, not just in the public hospitals, but in the private hospitals, in the aged care sector, in general practice, and in all of the other specialist practices that are outside hospital. We have not seen those numbers yet. How good would it be if we knew exactly the problem that we're dealing with? Because the green shoots are, the good news is, we are getting thousands of offers of help, and I'm sure some of them are genuine, and we have philanthropists standing by ready to help us. But to clarify any problem in any business or in life, you need to understand exactly what the problem is. That's why we're asking for openness and transparency. And when we get the gear, the staff still need time to train for it, so we need to slow down the cases. I can tell you, surgeons and anaesthetists and GPs and nurses are out there buying their own stuff because they don't have the trust that what is being hinted at will be delivered by the government is going to be there. They know how close it is, just a few weeks away, until we potentially have lots and lots of cases, and they're not going to take the risk themselves now that the government doesn't deliver. The AMA and doctors and nurses and everyone on the front line are asking you to be kind, be compassionate, be calm, be hopeful, but don't be patient. Now is the time to go hard and to lock down.